48,000 of that had either been flagged for termination, been terminated, or were going to be terminated after you did clear the backlog. Is that number still 48,000? Less than that? Where are we at now?
Come on up, John. Y'all going to have to start helping now, so Mo can come up here. I'm going to turn it over to them. The number that is 48,000, or I think it was less than that, but whatever that number is, that backlog has been concluded, and so those people are either ineligible from an income standpoint, or they have shown their eligibility through income statements that have been submitted, or they still haven't submitted information. And so, under the circumstance that they've proven they're eligible, then they're not going to get any notice of termination. They're reinstated and it's retroactive. If they haven't submitted the information, the notice of termination will go out.
We've done about 2,000 reinstatements already. So those would likely be those 48,000. 48,000 is the number who received termination notice. That number will never go down. But we've done now about 2,000 reinstatements. I think the number is probably even higher than that.
And again, that's the we're figuring out how much it's costing the state to take down this overtime to hire these positions. And I guess how does that compare to estimated savings that you're making from doing this redetermination?
I'd like you to come and talk about what your county offices are doing. I think I've met with some of your county officials. They're willing to do overtime. They've done overtime. They've worked on weekends. But talk a little bit about your county operations, how you're handling that, and then we'll address the cost issue.
Well, we are pleased with the outpouring of support from staff within our county offices. We had a total of 300 staff that volunteered to work overtime hours to take care of the income verifications to ensure that everyone that sent in income verifications, we have processed those, and we have been able to accomplish that. And I want to thank the governor for authorizing that overtime, because that has made a significant difference in our ability to process these cases and ensure that moving forward that we will have all of the income verifications processed that have been received in our office, and we can move forward with future closures.
Did you want to comment on the cost?
Well, the cost will vary depending on how much we need. We won't use overtime if we don't need. We've done, I think, about 2,000 hours thus far. That's probably at a cost of about $50,000. So compared to the size of the program, I think this is virtually the entire Medicaid program, not a private option. It's a small cost compared to total. Obviously, we don't spend any money we don't need to, but we need to serve these people well.
Well, and you're hiring more staff also.
Right, vacant positions, but those staff positions work in DOD's budget. They're just positions that, the governor was speaking to trying to have filling positions that weren't needed in the state government. He's released these for us to fill their budget positions.
I was persuaded these positions are necessary, and so we lifted the freeze on these 35 positions. They're already budgeted, but they will be filled. Go to work should fill that gap.
You have mentioned that based on the pace of these reinstatements that are we looking at a significant number like 40,000 people not on the Medicaid or private option rolls by the time you guys are through with this analysis?
John?
We just don't have an estimate at this point. It would just depend on how many people get back to us with information, and then how many over the course of, as the governor pointed out, the 9-day period center, how many at some point come back to us to get reinstated. We just don't know what the number's going to be.
If you kind of equated a 10-day window being almost the same as a 45-day window, because those kind of occurrences can still occur, don't you think there'd be less than 45 days than 10?
The key is, to me, and the reason that the 10-day window is right, one, it is what we have utilized in previous administrations for re-verification of income. And so it's the status quo, it's the customary. And secondly, if you put a 30-day window in place and somebody is ineligible, and then it goes beyond that to 90 days beyond that for the appeal process, ultimately, when you're talking about tens of thousands of people, you're talking about millions and millions of dollars. So there's millions of dollars at stake between a 10-day window and a 30-day window. And so if somebody is not going to respond to a request from DHS for information, they're not going to respond in 10 days or 30 days. And so 10 days invigorates the process earlier. And that is important ultimately to reach the right determination. And so I think we've got a good balance now of a good time frame, built-in protections, with processing time, assurances by the county offices that information submitted will be processed before decisions are made. And then with the agreement with the carriers, we've built in as many protections as we can, balancing that with the need for the redetermination because so many millions of dollars are at stake.
As far as the agreement with the carriers goes, it's my understanding that there's a large number of people who might have lost their coverage who are on the traditional Medicaid program, not on the private option, who would not receive those benefits. I mean, so the people in the Medicaid who are medically frail classification, ARCA's beneficiaries. Is DHS taking any kind of steps to provide similar pharmacy coverage for people that have lost their benefits?
Yeah, we don't have a way to provide coverage like that. What we are doing is identifying those high-need individuals, such as even within the medically frail population, we've identified 1,300 who we think are they've got meds they probably need to be getting. So those folks, we will expedite, we'll check and say, have they gotten any material into us? And if so, let's process it quickly. Now, obviously, they haven't responded to us. We can't put them back on the program. But as soon as they do, we're giving them expedited service to get them back on the program.